Hello, I'm Kate Pronger. I'm the lead nurse for the alcohol care team in Aneurin Bevan University Health Board, and the liver disease implementation group has been fundamental in our success for our service. We meet with the other alcohol care teams across Wales, and we've discussed things that are working well for those teams, things that are not sort of working so well, just sharing best practice, which has enabled us to develop to where we are today. Having support from your peers is so important, and knowing that other teams are going through the same challenges as yourself is quite reassuring as well. But we've all come together in an attempt to tackle those challenges, and it most certainly is working. Thank you.
Hello, my name is Paul John and I'm the Bloodborne Virus Community Pharmacy Lead for Wales. My role, which is currently funded by the Liver Disease Implementation Group, has helped us reach patients that necessarily wouldn't access first-line primary care services such as GP surgeries. We have taken bloodborne virus testing into community pharmacies and introduced it as an enhanced service, the 6 Welsh prisons, the town centres, substance misuse settings and onto street projects. Some of our patients may have experienced very chaotic lifestyles, so we try to tailor treatments to fit their current situation and to bring it out into the community. The benefit of expanding bloodborne virus services into the community is obviously reducing hospital pressures and treating patients in the most convenient manner for them to maximise their outcome and reduce onwards transmission. Over the years, we have tested and treated thousands of patients, screening for hepatitis C, hepatitis B and HIV with successful community and prison projects which have been recognised nationally. Our focus going forward is to eliminate bloodborne viruses by 2030, and my aim is to increase screening in pharmacies and have easy access to community treatments.
Hello, my name is Joanne Taylor and I am the Information Awareness Lead at the Children's Liver Disease Foundation. This is a brief update of the work we have done over the last couple of years with LDIG funding. We have used the funding for 2 main purposes. The first is the promotion and increased awareness of the Yellow Alert campaign to healthcare professionals in Wales. This is really important because the Yellow Alert resources help healthcare professionals spot the early signs of liver disease in children, thus enabling faster referral to specialist centres. Also, the funding has been used to provide additional emotional and practical support to children, young people and their families affected by childhood liver disease in Wales. So, over the last couple of years, we have forged links with healthcare professionals in Wales, in particular with health visitors and midwives, providing Yellow Alert protocols and education packs. We undertook, in particular, a postal programme, sending 405 Yellow Alert packs to GP practices in Wales. This has all helped to increase awareness of the Yellow Alert campaign amongst healthcare professionals. We also distributed our charity publication Live Alive to 247 families and professionals in Wales. In addition, I have recently joined the charity as the Information and Awareness Lead, and I'll be building on the work we've done in Wales to date by producing a professional news bulletin which will be distributed amongst professionals. On the support side of things, 250 families have benefited from emotional support and practical assistance and guidance thanks to the funding. We have a children's and families officer who acts as a named key worker, offers one-to-one tailored support and also an ongoing wellbeing programme. So all this additional work has been made possible by the LDIG funding, and this work will continue and the resources will be also available in future. Thank you.
Hi, my name is Kieran. I'm the Peer Programme Manager for the Hepatitis C Trust here in Wales. Thanks to the LDIG funding over the past 18 months, we've been able to set up our pilot project here in Cardiff in the Vale. We've been helping people who are at most risk of hepatitis C access treatment, testing, and most importantly, educational workshops and peer-to-peer support about how to use better harm reduction tools to decrease the risk of first contracting hepatitis C, but most importantly through our educational workshops, we've been trying to tackle the stigma that many people face when diagnosed and trying to access treatment for hepatitis C. We've been working closely with Cardiff and Vale University Health Board in particular and their BBV outreach nursing team. We've helped change and develop the pathways, take the care to the patient rather than the patient having to come into hospitals or set clinic times. We've been as adaptable as necessary and as thorough as necessary to ensure that the patients receive the best care. Thanks to the many options of care that the PEER programme offers, we're able to support those most vulnerable patients, even from dropping off medications daily to creating plans and agreements with local pharmacies or dispensaries where patients can collect their medications from there if they don't feel like they can keep it on their own. We've been doing some great work so far and we look forward to doing great work in the future.
Hello Aldig, thank you for your support and guidance. It's enabled us to deliver the Hepatitis C Follow Me PEER project with some notable successes. I want to highlight a couple of them here. The team have meaningfully engaged in nearly 900 service users, educating around Hep C awareness, harm reduction and Hep C prevention interventions. The team have tested nearly 400 individuals for bloodborne viruses and received 90 referrals for people with hepatitis C requiring additional support to gain access to treatment, of which to date 59 have started. The team have also trained over 200 staff from harm reduction, treatment and allied services across Cardiff and the Vale, and this led to a notable increase in testing across the board, and for me something I'm particularly proud of. Continual reports of how staff competency and confidence has increased massively with our support, enabling them to more effectively engage with people living with or at risk of hepatitis C. All of our work is underpinned by a small but growing army of PEER volunteers. We have 7 at the moment, 5 with lived experience of hepatitis C. Thank you for all your ongoing support. I'm looking forward to continue working with you as we collectively work in partnership to deliver and meet the aims of eliminating hepatitis C across Wales. Thank you.
Hello, my name is Claire Constantino and I'm a clinical lead dietitian in Cardiff. I joined the Liver Disease Implementation Group in September 2022. As a profession, dietetics is really keen to be involved as there's lots we can offer to support prevention of liver disease and to support people living with liver disease. With the support of the Liver Disease Implementation Group, we established a dietetic working group. We had fantastic engagement from services across Wales. We held our first meeting at the end of January and every single health board was represented. We knew that the dietetic workforce for hepatology services in Wales was insufficient, but the workshop enabled us to scope out the scale of the problem and to start collaborating to develop standards around dietetic services, around dietetic workforce, patient assessment, and also developing patient resources. The Liver Disease Implementation Group has facilitated the work that's been undertaken so far, and we hope to continue this work to improve care for people with liver disease in Wales in 2023. Thank you.
Hello, my name is Nick Williams. I'm a hepatology dietitian working with Jeanette Starkey in the Gastroenterology Dietetics Department at the Wrexham Myler Hospital in the Betsy Cadwallader Health Board. Together, we have set up a new service to offer treatment to patients with liver cirrhosis in the inpatient and outpatient setting. The gastroenterology service in our area is dealing with high demands, and the need for dietitians specialising in liver disease has been highlighted over the last few years. Last year, funding was allocated for a temporary position to fill this gap in our service and build a business case to bring our services closer to the standards of other areas in the country. Our service aims to offer specialist dietary management to the most vulnerable liver disease patients, spanning across settings to improve patient outcomes, quality of life, understanding of their condition, reducing hospital admissions and treatments, ambulatory treatments, and reliance on certain medications. Over the last 3 months, we have been working to build up the service with ward cover, outpatient clinics and service development such as ward education, standards of practice and patient resources. We now look forward with excitement as we collect and analyse our patient data and build a business case with the hope of continuing our hard work and delivering the service to those who need it.
Bore da, good morning, my name's Julie and I've worked here in Wales as part of the British Liver Trust's outreach team for the last 5 years. The focus on liver health provided by the Liver Disease Implementation Group has been hugely important in raising the profile of liver disease and liver cancer. Our work in Wales has centred around raising public awareness of the risk factors for liver disease, supporting patients and working alongside healthcare professionals to improve patient outcomes.
We've been very proud to be part of the Liver Disease Implementation Group and to contribute to its fantastic impact over the years. In many ways, Wales has really led the way by having this clear and prioritised focus to improve liver health outcomes. When it comes to diagnosing liver disease, GPs can't always rely on patient symptoms to know if there is a problem, because liver disease is a silent killer. There are often no symptoms in the early stage, and sometimes people start to feel ill when the condition has progressed to a point where treatment options are limited. And so many of the LDIG projects have centred on creating momentum for long-term change. And an excellent example of this was the All Wales Liver Blood Test Pathway. Fantastic work. This was launched as a new guide for doctors in Wales and was devised by hepatologists from across all health boards in the country. The new guide simplifies and improves on an older pathway that doctors in the UK often follow. The pathway ensures a consistent approach across the whole of Wales and could only come about because of collaboration.
One of the things which we found has had huge impact during our time working with the Liver Disease Implementation Group is our Love Your Liver Roadshow activity. We take our mobile unit out all over Wales, giving people the chance to come on board, learn more about their liver health, and have the opportunity to do our liver health screener and even have a free scan to find out the exact health of their liver. This all dovetails perfectly with the work we do around early detection and the fact that so many instances of liver disease are detected far too late.
Very often I think when you've got an illness that's ongoing that will, you're not recover from, you do feel very alone. You forget that other people have got this disease as well. It just becomes something that isolates you in a way, especially if you don't know how to talk about it. So that's where the Liver Trust really helped me. It coaxed me to talk about it, which really is then the start of, I guess, the healing process, isn't it?
Patient groups are an essential means of support for both patients and family members, where they get peer support from others affected by liver disease. In raising awareness, it's been crucial to utilise the strong health and wellbeing networks that already exist in Wales. In addition to working closely with liver nurses and doctors in local health boards, we also work with their engagement teams and with our colleagues in the local voluntary councils in all counties of Wales.
It's really, really important to give people information to understand about what they need to do to look after their liver. And I think we all know that liver disease doesn't have the profile that many other major health issues do. So we've spent a huge amount of time looking at how we can promote those messages. We've had particular focus every January as part of Love Your Liver Month, when we've done dedicated promotion throughout Wales via social media and also using local, regional and national media to drive those points home.
Throughout our work with the group, the clinical lead, Andrew Yeoman, has been a source of inspiration and knowledge, and it's thanks to his passion and dedication and also of our fellow LDIG members that so much has been achieved during the lifetime of this group. And while the cessation of the group leaves the future considerably less certain, we take solace from the fact that the hard work of so many people has left a legacy of established and effective systems to address the huge challenges of improving liver health outcomes throughout Wales. Thank you.